Peninsula College of Medicine and Dentistry is a medical and dental school in England, run in partnership with the University of Exeter, the University of Plymouth and the NHS in Devon and Cornwall. In January 2013 the school began disaggregation to form Plymouth University Peninsula Schools of Medicine and Dentistry and University of Exeter Medical School. The school has campuses at the University of Plymouth, the University of Exeter, the John Bull Building, the Royal Devon and Exeter Hospital and the Royal Cornwall Hospital. Teaching of medical students took place at North Devon District Hospital in Barnstaple, South Devon Healthcare Trust in Torbay and General Practices across the region, plus a number of community-orientated healthcare settings. Peninsula Medical School. History. Peninsula Medical School was established on 1 August 2000 following a successful bid to the government, as part of a national expansion of medical student numbers in the UK. The bid was creatively led by Professor Sir John Tooke, who was then working in a joint appointment between the University of Exeter and the Royal Devon and Exeter Hospital. Professor Tooke was subsequently appointed as the school's first dean, a post he held until autumn 2009. His vision and drive have been recognised nationally by his appointment as chair of the UK Committee of Heads of Medical Schools, and by the award of a knighthood in the New Year Honours List for 2007. The school was opened as a part of the British government's attempt to train more doctors, which also saw Brighton and Sussex Medical School, University of East Anglia Medical School, Hull York Medical School and Keele University Medical School open the doors. According to the league tables in the media, PCMD has not only consistently outperformed the other new institutions, but has proven highly competitive against established medical schools. In 2012, the two founding members of the Peninsula College of Medicine and Dentistry controversially outlined their plans to expand independently and grow the success of the now nationally recognized professional health education provider. With an equitable split of total student numbers, Exeter created a new medical school, University of Exeter Medical School, while Plymouth created a new medical and dental school, the Plymouth University Peninsula Schools of Medicine and Dentistry. The deans of the new Exeter and Plymouth medical schools are Professor Steve Thornton and Professor Rob Sneed, respectively. Existing students are taught under the terms of the current joint arrangements and will graduate with joint degrees at the two universities. New students entering from September 2013 study for independent University of Exeter or Plymouth University degrees. Undergraduate degree program. The first intake of 130 undergraduate students commenced the studies on 30th of September 2002. From September 2003, the annual intake rose to 167. In January 2006, Peninsula Medical School was awarded funding for a further expansion, and the UK and overseas places increased. The school's intake rose to 214 from September 2006 and 230 from September 2010. Undergraduate program structure. For the first 2 years of the undergraduate program, students were based at either the University of Exeter or the University of Plymouth. The learning emphasis is placed upon biomedical sciences, taught within the context of relevant clinical problems. From the first week of the program, students learn in various community-based clinical environments. In years 3 and 4, students spent the majority of the time in acute and community-based clinical placements that were based at one of the school's 3 main localities in Exeter, Truro or Plymouth. During Year 5, students were attached to clinical apprenticeships with general practitioners and consultants throughout Devon and Cornwall. Research within the college focused on four main themes: diabetes, cardiovascular risk and aging, neuroscience, health services research, and environment and human health. In the 2008 research assessment exercise, Peninsula Medical Schools submitted in 2 units of assessment: other hospital-based clinical subjects, and health services research. In other hospital-based clinical subjects, 65% of the submission was judged to be of international or world-class quality. This ranked Peninsula Medical Schools research 11th of 27 submissions from other UK medical schools. The research in the health services research category was also judged to be of high international standard, with 50% of Peninsula Medical Schools submission judged as international or world-class, ranking them 13th out of 24 submissions. Peninsula Dental School History. PDS was established on the 26th of January 2006 following a successful bid to the government, as part of a national expansion of dental student numbers in the UK. It is the first dental school to open in the UK for 3 decades. The Peninsula Dental School was a member of the Dental Schools Council. Its inaugural dean was Professor Liz Kay. Bachelor degree program. The Peninsula Dental School trained 64 dentists a year and offered a joint Bachelor of Dental Surgery degree through the Universities of Exeter and Plymouth. The program was 4 years, designed for science graduates or healthcare professionals. Undergraduate program structure. For the first 2 years of the dental program, students were based mainly at the University of Plymouth. The learning emphasis was placed upon core clinical and communication skills. Peninsula Postgraduate Health Institute. The Peninsula Postgraduate Health Institute contracted with the NHS in Devon and Cornwall to provide taught programs and research opportunities in medicine, health and social care, working in collaboration with the NHS. The programs were provided by the University of Plymouth's Faculty of Health and Social Work and schools of the University of Exeter. The Peninsula College of Medicine and Dentistry was represented on the board of PPHI. Peninsula Allied Health Collaboration. The Peninsula Allied Health Collaboration was a separate collaboration of the 2 universities, together with the University of St Mark and St John, Plymouth, which contracted with the NHS to provide undergraduate programs in allied health professions such as nursing, occupational therapy, and radiography. The programs were provided by the collaborating institutions, but students could take modules from more than one institution. The Peninsula College of Medicine and Dentistry was represented on the board of PAHC.